Everyone, welcome back to my YouTube channel. This is Nursing with Annie on your screen. I film about nursing, health, lifestyle, and faith. And on today's video, I will be teaching you how to pass an Osce exam without having to come for the Osce exam again, or without having to sit for the Osce exam. You are going to pass your Osce exam once and for all, be it nursing council, be it in your semester exams. Yeah, so that's what I'll be teaching you on today's video. If you're interested in this video, do sit back, relax, and enjoy. So you're welcome back. Like I said, I'll be teaching you how to pass an Osce exam in nursing school, be it in your semester exams, be it in your council exams, whichever exams you have to take, and Osce is among the exams. Following these steps I have on the board, you are going to pass them instantly, pass your exams instantly. First of all, what is an Osce exam? The full meaning of Osce is Objective Structural Clinical Exams. You take these exams, it is practical, and you take it after you must have done the theory part in your nursing school exams. Most especially for practical reasons, you take the Osce. Objective Structural Clinical Exams is what it is, the full name of Osce, or that is what Osce means in full. So you might be wondering, what is Osce? What is Osce? You cannot escape it in nursing school. How are you a nurse without Osce? This is the practical aspect of nursing, and you know what it means. It helps the examiners to know that you actually know what you are doing. Apart from what is inside your head, you can actually carry it out in practice on a live patient. Yeah, so concerning Osce, like I said, Objective Structural Clinical Exam, it is done in two phases. We have the question station, we have the practical station. So when you walk into the Osce room, you are going to see 12 stations, 6 question stations, 6 practical stations. In the practical stations, you are required to carry out the practical of what you have to do, either on a live patient or on a dummy or whatever is being provided. And in the question station, you are going to answer questions relating to what was asked, what you were asked of to do in the practical station. Yeah, so without much ado, let me read out what I have on the board. First of all, if you want to pass an Osce exam in nursing school, you have to practice. What do I mean by practice? You have to do constant practice, be it yourself, be it with your friends, with your study group. You just have to practice because it is practical. So don't neglect this aspect. You have to practice in order to get it straight or get it correctly. Then the other one I have is be bold and confident. When it comes to being bold and confident, this has to do with when you are in front of the examiners. You have to maintain this boldness in you and confidence, even when you don't know the particular procedure or you don't know where to start from. Just let them see it in your face that you are bold and you are confident. When they see fear, it automatically tells them that you don't even know what you are doing. Yeah, so you have to be bold and confident, though it might not be easy, but just have to be bold and confident. The next one I have is take away anxiety and fear. You just have to take away anxiety and fear. Tell the Holy Spirit to help you. He said he has not given us the spirit of fear, but of love, peace, and of a sound mind. Tell the Holy Spirit to help you. You are going to be anxious, definitely. When you remember that you are going to be facing your examiners, and then you are going to do the talking and practical on either a live patient or a dummy, you will just be anxious. Like, it's a normal thing. I know how many times I get anxious when I'm about to enter the procedure room. Either fear of seeing a procedure I'm not conversant with, or fear of not saying what is in the checklist. Now, another one is greet your examiners. When you enter the procedure, when you enter the hall where you'll be taking the exams, you have to greet your examiners. It shows a sign of respect. You have to, recognize their presence, and you'll be standing in front of them. So you have to greet them when you enter the exam hall. Then the next is read out the procedure you were asked to carry out and the instruction that follows. This is very important, because sometimes with the anxiety and fear, you just go into the procedure, you just go into the exam hall where the practical is being carried out. You don't even look at the procedures that you were asked to carry out. You just go in there and then you start to do whatever. So it happens a lot. And when it comes to the procedure questions, there are also sub questions that are under. For example, they might say carry out a procedure on a patient, giving administering a drug and taking precautions while you proceed with the procedure. And then if you don't read the instructions, how do you know that you are supposed to state the precautions to take when giving administration of drugs? So this is why it's very important that you read out the procedure you were asked to carry out and the instructions that follows. It is very important. Another one is be loud when talking. You have to be loud when you are talking. Let the examiners hear you. Let them hear what you are saying, because in OSCE the examiners don't talk to you. You just come there, perform what you have to perform, and then you leave. They don't talk to you at all. So you just have to be loud when you are talking. Then say your exam number. Immediately you greet the examiners, the next thing is to call out your exam number. In nursing exams, we don't use our names, we use numbers we are given for the exams. So you have to say your exam number for them to be able to document it. Then next is scan the equipment and instruments available to know where to start from. Once you enter the exam hall where the procedure is to be carried out, you should use your eyes to scan for the instruments and the equipment you were given or that was made available to know where to start from. For example, you are asked to assist a patient with oral care. Most times what we have in mind is oral care of an unconscious patient. Do you understand? Like, most times what we have is what the procedure that is common when it comes to oral care is for the unconscious patient. So maybe they change it and they say assist a patient in oral care. They didn't state if it's unconscious or conscious. And then you came in front of where the equipments were assembled and you noticed there was no mouth guard, you noticed there was no glycotymolene, glycerin, borax, you saw toothpaste, toothbrush. You already know that this is oral care for a conscious patient. So that's why I say when you go, you scan the equipment you were given, scan everything that you are seeing on that table before you go ahead, so you will not make mistake because you have a certain procedure in your head. Then ask for assistance when necessary. This has to do with when it comes to positioning of a patient, when it comes to bed baiting, when it comes to bed making, when it comes to, there are so many procedures that need assistance. So once you read out the procedure to carry out, the next thing that should come to your mind is, will I need an assistant for this procedure or not? Very important, because when you carry it alone, you have lost some marks because you are meant to call for an assistant. Then make sure you answer the questions in the question station and write your exam numbers first thing before answering the questions. Very important. Make sure you answer the questions that will be given to you in the question station. Make sure you write your exam numbers on it. Many times students write the questions and then they don't write their exam number, and this, especially when it comes to cancel exams, in these exams everybody, you're on your own. The examiners will not have that time to start calling you to come and write your exam number, start looking for you, here and there. You just have to remember to write your exam number when you are answering questions in the question station. Another thing you should know is in every procedure, always assemble your equipment. You must state it that you are, yes, the equipment will be there already because it's OSCE. The equipment will be arranged for you, but don't still forget that if it was in a live situation whereby you're in a hospital setting, you will be the one to assemble these equipments by yourself. So don't forget to assemble your equipment to the bedside, and don't forget to tidy up your work area after the procedure. You might not do it because it's OSCE. Another person has to come and continue from where you stopped, but just say it. Let them know that you know what you are doing and saying. So you say, I will tidy up my work area, or tidy up my equipment or the equipment, and send them back to where they're supposed to be. Don't forget. And also, as a nurse, for every procedure you carry out, no matter the procedure, you have to wash your hands and wear your gloves, because you are dealing with human beings and you'll be exposed to fluid, you may be exposed to different substance from the person you are handling. So you have to wear your gloves, wash your hands, wear your gloves. It is very, very important. Don't forget, no matter the procedure you are carrying out. Always remember to wear your gloves and wash your hands. Wash your hands and wear your gloves. And also, don't forget to provide privacy where needed. Don't forget to provide privacy where needed. You know, like screening the patient, you don't forget to do that where needed. Yeah, so I've come to the end of this video. You can go through what I've written on the board or what is on the board. Yeah, thank you for watching. This is Nursing with Annie. If you're not subscribed to this channel, why are you not subscribed? Why don't you want to get value? Yeah, so please do subscribe. Like this video. If you watch to the end and you like it, give it a like, give it a thumbs up, turn your notification bells when I post a new video to get notified. Share this video to your friends, family, loved ones, for anyone who you know this video will be beneficial for or to. Please share it. Yeah, and I'll see you in my next video. If you have anything you want to ask, drop it in the comment section. I'll be so glad to read them and I'll reply you ASAP. Yeah, till I see you again, I still remain your one and only Nursing with Annie. See you in my next video. Bye.